Thank you so much for the opportunity to share some recent perspectives and thoughts that we have on the problem of traumatic brain injury and what we are able to do about it and where we're going. I'm thrilled to be back. I spoke at this conference a few years ago, and I'm very, very happy to see how much progress we have made, and I'm really hoping to share that excitement with you. So I'm going to start off my presentation by focusing on a topic that almost everybody knows about, and that is sport-related concussion. What you might not have known is that 50% of Canadian youth have had a concussion, and most of these are from playing sports. About 30% of youth athletes have recurrent concussion, and about 30% of youth athletes that have had a concussion remain symptomatic for more than 1 month. The other 70% recover within 1 or 2 weeks and are back playing the sports that they love. But we have a pretty big group of people that are struggling to fully recover, and this is something that we need to do a lot better work with. We're learning a lot about brain injury and concussion from studying it in the context of sport. But there are a lot of questions that still remain to be answered about concussions that might come from other mechanisms, such as a fall or a motor vehicle accident. We also need to know a lot more about whether there are differences between men and women with respect to their concussion propensity or how they recover, and whether the age at injury really affects recovery and what we can and how we can best help. So sport-related concussion is pretty much what everybody hears about in the newspaper. But one of my first take-home messages for you tonight is that there are many, many more types of concussions than what we see in sport. And many of these deserve the attention that we give to sport-related concussion at this time. So I'm very excited to finally be able to announce a new study that will become a flagship study for Canada on sport-related concussions. This study is called SHRED Concussions, and it is basically about surveillance of concussions in high schools, and then gathering a lot of data to be able to reduce concussion incidence and treat concussion better. It's led by Dr. Carolyn Emery, and her picture is on this slide, at the University of Calgary. Now, this study was recently funded by the National Football League in the United States, and we are the only Canadian group to be funded by this organization. The study will enroll 6,000 grade 10 students across Canada. So 1,200 per participating province, and these students will be playing one or more of a selection of sports that have a high risk of concussion. So these kids will be age 13 to 15 upon enrollment, and we will be following them for 3 years. So every year they will have a baseline assessment, and then if they have a concussion from any cause, with their sport or outside of the sport, they will be given a complete protocol of follow-up assessments. So the scale and the scope of this study will be unprecedented in Canada and will give us a lot more information than what we have now. Most studies of sport-related concussion, maybe 20, 30, 50 participants. 6,000 is a much, much bigger number, and we'll be able to then dig down into some of the granularity that we need to address. So this is just a snapshot of the overall protocol of SHRED concussions. And at baseline, you can see that there's quite a bit that the kids will be asked to do. My particular role within the program is to do the blood testing, and I'll share a lot about what we're doing in that area. But they get a very comprehensive battery of neuropsychological assessment, a lot of tests involved in the physiotherapy domain. We have a lot of interest in vestibular ocular issues after concussion. They will do a kid arm test, which is a robotic system where you grab a couple of handles and you have to hit a target. It's like a video game, and from that we can measure things like reaction time or your accuracy in hitting that target. A subset will get MRI imaging, and all of these data will be collected and analyzed in great detail. The kids will also have an activity form to fill out pretty much every week. It's a big commitment for these participants. And at the end of the day, we will have probably the biggest data collection on youth sport-related concussion perhaps in the world. I know that there's a study in Finland that is undergoing right now that's about the same scale, but I don't know their protocol, and I don't know if they have everything that we have here. So this is exceptionally exciting. If there are anybody in the audience, and I'm going to be shameless here, that has connections to other sort of sporting organizations, et cetera, we've got a lot of partners on this already, and it's a big budget that we have, but it's already been cut since we put our proposal into the National Football League, and there's a lot more data that we would like to get. So we'd like to now leverage this success and keep building on the promise of what we can do. So on this slide, I'm just listing some of the partners that we have already that are committed to the SHRED program, and we're looking for more participants. So if you have any questions, or you can think of an organization that might want to help with the SHRED study, please get a hold of me. My email will be shown later at the end of the night, and I'd be happy to work with you. So this is what everybody's worried about with sport-related concussions, chronic traumatic encephalopathy. This is a neuropathological diagnosis. It is a chronic neurodegenerative condition that is defined by being able to detect tau protein in the brain, primarily at the depths of the sulci, so that's the bottom of the folds of the brain, and especially around the blood vessels of the brain. And you can see here, these are slides from the group in Boston. So Anne McKee, her group has been really leading the world in understanding what CTE is. You can see here the brown stains are tau, and as CTE progresses, tau spreads through the brain, and this causes a lot of problems for the people that are affected. There are a lot of things about CTE that we do not understand. And the first and most important is that we have no idea what proportion of athletes with high concussion exposure actually will develop CTE. All of the brains that have been examined so far are donated by people who believe that they have a neurological problem. There is no data out there that is systematically generated to tell us what proportion of people might get this disease, or how the pathological presence of tau correlates with the behavioral problems that CTE patients have while they're still living. So there's a lot of concern that we have with CTE, and this is a big field of research that I'm involved with the international consortia that I work with. So we want to know how common CTE is, how can we possibly diagnose this in living people, and then what can we do about it. So coming from the world of dementia, where tau is also found in the brains of people with different types of dementing disorders, including Alzheimer's, there are already drugs that are being developed to target tau. So we want to know if those drugs work to decrease tau, either the amount of tau that builds up in the brain or it's spreading. If we give them to CTE patients, can we stop that disease as well? These are just some of the questions that we need to address. One of the other questions, though, and the big mysteries within CTE, is that just one single lesion of tau in a very specific part of the brain is enough to give you the neuropathological diagnosis. But one lesion really cannot explain some of the very complex problems that these people have with depression, anxiety, etc., etc. So there's a mismatch between what is going on in the living human being and their lived experience and what the pathology shows us. And this is where I think that the media has a lot of a role to play in how we think about CTE. So this is an opinion paper that should be out in Lancet Neurology, hopefully yesterday or today. The chief author was Willie Stewart. So he is basically the person that has the biggest collection of traumatic brain injury brains for pathological analysis. This opinion piece really comments on a recent article that criticized a neuropathologist at the Hospital for Sick Kids for missing a CTE diagnosis. And what we want to point out in this paper is that as a pathological diagnosis, it is common that pathologists will debate, is it this disease or is it that disease? And to have the media blame this person for not saying that this person had CTE is probably dangerous. One of the most devastating things that happen to a lot of people with presumed CTE is the suicidality. A lot of the brains in the Boston collection are donated from people that committed suicide, often in ways to preserve their brains. But we do not know, for example, if all of the people that are experiencing depression, anxiety, and real problems after retiring from sports, for example, have CTE, or whether they might simply have the very common disorders of depression and anxiety, which are much more treatable. So this paper is really calling for caution for the media to not say everything is CTE, because it's giving a lot of fear within the public, and we're seeing a lot of kids being pulled out of sports, and that might have consequences for their physical fitness and lifelong physical participation. Of course, we want to keep kids safe, but we also don't want to go too far in the other direction and really be able to understand how some people have problems after playing sports and getting a lot of concussions, others do not. And CTE, these tau pathologies that are in the papers may or may not be the real thing that we need to be chasing. So I would love to have debate about this and discussion about this at the panel. Now I want to move to broaden our perspective from sport-related concussion. So on these two graphs, you see data from the Centers for Disease Control. On the left-hand side is the emergency department visits by age, and on the right-hand side is the deaths by age, and this is attributed to traumatic brain injury. The age groups you might not be able to read because the text is very small. I apologize for these. We are redrawing these graphs for better presentation use. But basically it goes from very young kids, the first few years of life, all the way up to seniors. And what I want to tell you is that in Canada right now, the biggest age group that has the biggest proportion of brain injuries and concussions are people over the age of 65. It's not the youth, it's the older people. And mainly they fall. On the left, the red bars are falls. Toddlers fall a lot as well. And when you look at the deaths by age, you see a different pattern emerging here. So falls are responsible for the mortality of brain injury in the older people. But when you look at the very young children, the biggest cause of traumatic brain injury, deaths in children, is inflicted brain trauma. This is child abuse. And we really do not, we don't have a lot of comfort yet in tackling that issue. There is a big project that we're developing with Dr. Paul von Donkler at the UBC Okanagan, who's gotten very interested in the topic of concussion in the context of intimate partner violence. We spend a lot of time talking about repetitive concussions in football, but It turns out that the majority of women in intimate partner violence relationships might have as many or more concussions as a part of that. And there are programs that are now starting for that. I've been given the 5-minute window, so I want to speed up a little bit. We also know that concussions are not the entire picture of brain injury either. Here are some famous people that have died from severe, fatal brain injury. And we don't really understand how to be able to save their lives a bit better. But we do have new technologies at our disposal, and this is something that my lab is leading within Canada in context with international efforts around the world. And this is really on the realm of developing blood tests for brain injury. Now, this picture is a neuron. The cell body is on the left-hand side of the slide, and the part that's wrapped in green is called the axon. This is essentially the wire of the neuron and how the brain is connected. The new technology that we have now to be able to measure biomarkers that come from the brain and go into the bloodstream is called single molecule array, or SIMOA. Now, until this technology came along, we didn't have the sensitivity to be able to detect or do a blood test for brain injury, but now we can. And this machine here, the way it works is that it is, I don't want to get too technical, but it's called an Eliza assay for the people that are in science. But the way that this machine performs this assay is to look at every single ELISA bead one by one. So in this way, it is capable of doing the equivalent of measuring 1 grain of sugar in an Olympic-sized swimming pool. So think about that. And that's the technology that we need. So I'm very fortunate to be the first in Canada to have this machine and to be running it for brain injury studies. And these are the sorts of data that we can get. So, for example, we can look at the level of serum tau protein in athletes, and you can see on the left-hand side that after concussion, the levels of tau come up and then they come down in a few days. There's another protein called neurofilament light, which seems to be even better, which correlates with the concussion history or the exposure to head impacts in boxers. So these are data that are already published. They were not generated by my group. What we're trying to do is really expand the scope of what we can use this technology for. So one of the big challenges in doing blood tests for brain injury is, well, unless you're doing a study on sport-related concussion, people come to the emergency department after their brain injury. You don't get a baseline for the average person that walks in the door. So how do you tell what normal is for that person? How do you tell when they're getting back to normal or different from normal? So this is where we have the ability to leverage really good biobanks within Canada to have a proxy of what normal is. So an example is this study called Caliper, which is run out of sick kids and has generated about 200 or so FDA-approved lab tests for children, but never so far for neurology. So this is a slide here where we're defining what normal is in children for serum tau, which is one of the biomarkers that we're using for concussion. So these are just normal, healthy kids, and they go from birth up to age 19. And from this, with a bunch of fancy statistics, and if you focus on the middle panel and the right-hand panel, you can see that the normal levels are very different according to the age of the child. So now that we know what the normal is, we can do a better job of looking to see the kids who come into the emergency department just randomly with a brain injury, how do they perform? And this is a study that we've just finished, and it's under review for publication right now, where we're showing for the first time that serum tau can discriminate within the mild traumatic brain injury category. So this includes concussion, But there's a lot of people within that category that we might need to follow, but there's a lot of people who are going to recover they're going to be just fine. And it looks like tau might have some diagnostic utility for being able to, for example, say totally fine. There's no evidence of damage within the brain. This is really important when you think about the use of CT scans in children. Now, head CT is what typically people will ask for when they go to the emergency department, but CT does involve radiation, and it is known that too many CTs in children will increase the risk of brain cancer. So we need to really balance scanning the kids who need to be scanned and making sure that we don't subject kids who are absolutely fine to not being exposed to that level of radiation. So tau, blood test, might be one of the ways in which we can help parents choose whether or not to scan. Okay, so I think I'm out of time probably already. I have a whole other section, but can I keep going? Yeah? It'll just be like maybe 4 slides more. Okay, thank you. So this is part of the clinical arm of what we're doing, but I also wanted to just share a little bit of insight about where we're also developing the animal models that we need for brain injury research. And this is important because when you get a brain injury, you don't get a brain biopsy. We really don't have much tissue to study and really find out exactly what is wrong with the brain. Or we have to wait till we get an autopsy, which might be 50 years after. So there is a need for being able to develop model systems. And this is where my group has really been instrumental in offering the field a new way to do this, which was this was done in collaboration with Mechanical Engineering Group here at UBC. And the platform that we have developed is called Chimera. And it's the first way in which we can produce very controlled brain injury in animal species, where we can collect pre-injury and post-injury samples and these have as much knowledge about the biomechanics as on the pathology. So, for example, this is some of the things that we can do. And this is looking at the motion of the head and correlating it with the damage that we see and the behavioral issues that we see. So these are the sorts of data that are collected when you think about the instrumented helmets or the patches that measure acceleration or velocity. And we're now able to do this even better in the animal model systems. And what's really interesting, and we can only do this in animal models, is to make sure that the imaging studies that we do, so for example, magnetic resonance imaging, that we see the correlations. We can understand how the imaging, what it means in terms of the pathology. So what you're seeing here, the black and white images and the colored images on the bottom are looking at changes in that axonal integrity, which we talked about a little bit earlier. And on the left-hand upper panel, that gray stripe you see is histological evidence of axonal damage within the brain. So from these data, we are now able to really define how we're working with brain injury so that we can understand what are the molecular targets, what happens to the circuitry of the brain after injury, and how we can use these model systems to develop better treatments. And we can do the same biomarker studies that we do in people. So we have a lot of different beautiful translational correlations. Now, one study that just got published today, I'm very happy about this, is a study in rats. Now, who here has heard of the marshmallow test? Yeah? Okay. Who wants me to explain what the marshmallow test is? Okay. So the marshmallow test, if you have a chance, Google it. It's a beautiful video. So it's a measure of impulsive control. So the tester comes in and gives the kid a marshmallow and says, okay, you can eat it now. But if you wait, I'm going to come back and give you another one, so you get 2. And what you're measuring is how long the kid is going to wait before he says, okay, I give up, I'm just going to eat one, want the reward. And you can see here this little boy struggling, like the video, he picks it up, he smells it, and he's like, no, I can't look at it, and it's just, it's fantastic. So we can actually do the same thing in rats using Chimera, and for the first time ever, we found impulsive behavioral problems after concussion. So in the rats, we gave them a concussion every 2 weeks, and after every concussion, we measured how long they would wait for the rat version of the marshmallow test. And you can see in the red that every time they had another concussion, they got more impulsive. Now this is exactly the kind of behavioral stuff that's going on with people with CTE. This is why the road rage happens. This is why the drug abuse happens. And so this is exceptionally interesting. We have now a mechanism to try to probe that. And then, and so we're really trying to understand the effects, the acute and chronic effects of long-term concussions. And then the engineers are super excited about looking for the very first time about the mechanics of brain tissue motion in a ferret model. So ferrets are cool because their brains are much bigger than rodents, and they're folded just like a person's brain. And so they're actually using high-speed X-ray videography, which is an exceptionally amazing technique where you can actually visualize what happens to the brain tissue itself. This has never been done before, and it's being right here at this university. We will now have, for the first time, information on mechanics and motion of living brain tissue, and we can then correlate that to behavior, pathology, biomarkers, everything like that. So we're taking multidisciplinary approach, clinical as well as preclinical models, and all of this work is being done in collaboration with many people around the world. These are some specific investigators with whom I work, but I'm also very, very grateful to the multiple national and international consortia of experts that I work with that really contribute to a worldwide effort in reducing the burden of traumatic brain injury. So thank you for your patience, and I